Canada's federal government is making a huge mistake by signing on to amended international health regulations of the World Health Organization. Our federal government seems eager to abandon our sovereignty by giving the Director General of the WHO the sole authority to declare a pandemic emergency and then to impose lockdowns, travel restrictions, vaccine passports, and state health surveillance on Canadians. This coming from people who seem to care very much about Canadian sovereignty. They get very upset when US President Trump talks about making Canada a 51st state, and you see them screaming about Canadian sovereignty. And yet some of these very same people would want to give up our sovereignty to an unelected, unaccountable bureaucrats based in Geneva. Fortunately, the WHO has no police force, no army, no courts, and it's got no power to enforce its edicts on Canada or on any other country. Nevertheless, our federal government should not be moving in this direction because it violates our own constitution, of which democratic accountability is a pillar. What democracy means is that we Canadians have a say through our elected representatives in what laws are going to govern us, what laws we will live under. So to abdicate that power and say that unelected, unaccountable foreigners are going to dictate our healthcare policy is problematic. It's also a problem insofar as Canada's Constitution gives exclusive jurisdiction over healthcare, exclusive jurisdiction to the provinces. The Constitution gives the federal government authority over marine hospitals, and that's it. Otherwise, healthcare is exclusively a provincial responsibility. We should not move in this direction because politicians will be able to use it as an excuse and violate our charter rights and freedoms through lockdowns and travel restrictions and vaccine passports. And they will say, well, we have no choice. We're just following international rules that we're required to follow. And so this is not a situation that we want to be in. Apart from our sovereignty, our democracy, and our constitution, the other question is, why would we want to follow the WHO directives in any event? We did so in 2020, and the lockdowns that we imposed, we were not required to do that. We chose to do that, to adopt these guidelines, these recommendations from the WHO. Lockdowns did not stop COVID from entering into the nursing homes. 80% of COVID deaths were in long-term care facilities. Lockdowns did nothing to stop COVID from entering those nursing homes, those long-term care facilities. Lockdowns did not stop COVID from spreading to every Canadian in every city, every town, every village, every hamlet. COVID spread everywhere. Perhaps the lockdowns temporarily slowed down the speed at which COVID inevitably spread. But in court actions where lockdowns were challenged as unjustified violations of our charter freedoms, in those court actions, governments did not present any persuasive evidence that lockdowns had saved any lives. They had lots of assertions, yes, but there is no evidence to suggest that they did. What happened instead is that lockdowns caused grave harm to many, many Canadians. And we are left with a legacy of a 15% increase in the rate of children's deaths in Canada after lockdowns and vaccine passports. We are left with a 22% increase in deaths among Canadians under the age of 45, 22% increase in the death rate amongst younger Canadians that's still in place with us now. We are still suffering from a 55% increase in in drug overdose deaths. So that's the legacy of following the World Health Organization directives when we did so 5 years ago. Why we would want to try to bind ourselves and make a commitment to follow these international health regulations in future just does not make any sense. Canada should join Germany, Austria, United States, Italy, and other countries who are not going to bind themselves to following the WHO international health regulations. You can find out more information about this from our Justice Center report released just recently, and you will find the link here below. I'm John Carpay. Thanks for listening.